Hello, I'm Minnie Scipio. Welcome to County Courier. Today I'm talking with Mr. David Pribble, who is the Executive Director for the Olde Towne Medical Center in Williamsburg, and Dr. Alan Norman, who is the Medical Director for Olde Towne Medical Center. Welcome to both of you.
Thank you so much.
Thank you. Mr. Pribble, Olde Towne Medical Center has been around for quite some time. Can you tell me how and when it was established?
Sure. We opened our doors in 1993. Prior to that, though, at the location on Old Town Road there in Williamsburg, we were the health department. And at that time, I think there was a plan to consolidate health department services in the area. So some leaders in the community, Williamsburg, James City County, and York County, got together and said, we need to have health services in this community. So they formed what's known as the Williamsburg Area Medical Assistance Corporation, which is a board, and then through funding support for the counties and the local area hospital, they opened their doors, as I said, in 1993.
Now, some of your members on the board, are they appointed by those jurisdictions that you mentioned? Or?
Yes. There are 2 members from each of the jurisdictions are appointed to the board and serve, and others are private citizens.
Okay. Now, tell me again the areas that you serve again.
Yes. York County, City of Williamsburg, and James City County.
Okay. So for York County, is anyone that's in York County, or is it specific?
Anyone from York County is eligible for services, as are those individuals from the City of Williamsburg and James City County.
Okay. And I know that the jurisdictions that you mentioned, do some funding for Olde Towne Medical Center. What are some of your other sources of funding?
One of the big funders that we have is Williamsburg Community Health Foundation, and we receive grants from them. We also receive financial support from the Riverside Health System Foundation. They primarily support our dental clinic, and then the Centera Health Foundation supports some of our dental programs. We also receive funding support from Centera Williamsburg Regional Medical Center, and then we have, as you mentioned, each of the localities, and then we do various fundraising activities.
Okay, so do you get state funding?
We do not get state funding directly, but we do receive that through Medicaid reimbursements.
Okay. Who is eligible to receive the services at Olde Towne Medical Center?
Individuals it's based according to an income determination, and it's based on the federal poverty level. So an individual would come there or call on the phone, and we would have them come in and fill out their income verification, and then depending on where they fell within the federal poverty level, the sliding scale fee would be established, and they would, if they did not have insurance, would be eligible for the sliding scale fee.
Okay, what kind of documentation do they have to come in?
Okay, there's paycheck stubs. Can you give a little more detail?
Sure. So the primary way we determine that is based on somebody's wages if they're working. We can also look at their tax returns from last year if that still represents the wages that they're getting. And then if it's somebody who doesn't have a job, although most of our patients do have jobs, there's other things we can look at the assistance they're getting through social services and other entities.
And you serve all age groups?
Yes.
Okay. Dr. Norman, part of the mission of Olde Towne Medical Center is to provide preventive care and intervention services to vulnerable and disadvantaged population. Talk about some of the services that you provide at Olde Towne Medical Center.
So we provide adult and pediatric primary care services. We have a chronic disease program because chronic diseases are so prevalent in our patient population. We have services, we have a mobile health van that takes care of patients who can't get to the clinic. We have an immunization clinic that serves not only our patients but pretty much all the patients in our catchment area if they need immunization, since the health department has an office down in Newport News and not up in our area. We also have a medication assistance program, so when patients are having a difficult time affording medications, we can help get them through medication assistance programs that are available through the pharmaceutical companies. We also have specialty services. There are many volunteers, doctors that both in the community and their practices, and doctors that come to our clinic that will see our patients for specialty needs. And then lastly, we have a obstetric program. So the Williamsburg Community Health Foundation and Cetera Williamsburg support that and takes care of the patients in our community that are pregnant that don't have health insurance or have Medicaid.
You mentioned the OB prenatal clinic. Talk a little bit more about how that was started.
Sure. Probably we've been doing that with 4 or 5 years now, I believe. And there was just not great access for patients who didn't have insurance. And the worry was they would go without care and show up in the emergency room when it was time to deliver. And those become very high-risk pregnancies and babies that tend to have complications. And so by getting grant funds and funds through other sources, we were able to provide preventative care in those pregnancies. And so moms do better and babies do a lot better.
Do you get a lot of grants for different things?
Yes.
You do?
Cetera Williamsburg Regional Medical Center provides a grant specifically for the OB prenatal program, and then the 2 primary OB practices in the community provide the delivery at the hospital when the mother goes there to deliver. And I know last year we had 200 expectant mothers go through the program.
Okay. Dr. Norman, is there any one health issue that you see more patients on?
Sure. When I first got there, we started to realize that a lot of patients had diseases that were related to lifestyle choices. And so patients who did know how to eat healthy and had fairly sedentary lifestyles would become overweight and get diseases like diabetes, hypertension, high cholesterol. And so we started a chronic disease program several years ago where we tried to give some education to patients about what a healthy diet looked like, why exercise was important, and then also dealt with some of the medications that we can use to help treat some of those illnesses. We got a grant through the Williamsburg Community Health Foundation, and over a couple years after our program started, they started a chronic care collaborative regionally that includes all the safety net clinics in the greater Williamsburg area, and we sort of work together to try to better manage chronic disease for our patient population.
Okay, now the education that you're doing, that's primarily for folks that come into your clinic once they have a problem.
Sure.
Okay.
So if we identify that they have a chronic disease where they need some education, we have a nurse educator that works full-time in our program through the grant that we received. And that has been really important because in a 15, 20-minute provider appointment, you really don't have the time to give patients the necessary education they need to learn how to adopt healthy lifestyles. By having access to not only an educator but also a part-time registered dietitian, we can teach patients how to properly eat and exercise on a regular basis to help prevent these diseases, hopefully, and help treat them too.
Okay. I know with the big health reform bill that was just passed, I was just wondering how this will affect Olde Towne Medical Center.
Sure. In the short run, it probably won't have a large effect, but as the parts of the bill become active, I think around 2014, a lot more patients will qualify for Medicaid, and so there'll be a much larger percentage of our patients that have Medicaid coverage. And then for those who don't qualify for Medicaid, if their income level is a little bit higher, those patients would be eligible for buying health insurance through the state exchange with most of their premium probably paid for by the federal government.
So you'll probably see your numbers increase?
I would think so. I mean, there's a primary care shortage throughout the country, and I think our area is probably no different. And so as we put more people into our healthcare system, they're going to have a harder time finding a medical home. And so we definitely want to continue to provide that service for our patients.
Okay. Now, do you ever run into a situation where you have to turn someone away from your clinic, where you can't help them?
It's rare.
But
yeah, it's not common. I'm trying to think of examples. Again, by the time the patients need our services, we're really usually their last resort. And so we try, if at all possible, to make sure we can meet people's needs, because if we can't meet them, they really have nowhere else to go.
We're going to take a break right now. When we come back, I'll talk a little bit more with Mr. Pribble and Dr. Norman about the Medication Access Program and the dental clinic.
Fruit. What a tasty treat. Fruits packed with potassium and other nutrients can help keep your heart pumping strong during the game. And they give you energy back so you can take on the next activity. Can your food do that? Run, throw, think, eat better. Find out more at smallstep.gov.
Welcome back to County Courier. I'm talking with Mr. David Pribble, who is the Executive Director for Olde Towne Medical Center, and Dr. Alan Norman, the Medical Director for Olde Towne Medical Center. Mr. Pribble, you have a dental clinic at Olde Towne Medical Center. Tell me when that was established.
Our dental program was established in 1997, and there's quite a story associated with that. At that time, well actually prior to that, when the health department relocated to Newport News, one of the volunteer dentists at that time was a gentleman that had a private practice in Gloucester, Dr. Thomas Luckham. And he was a volunteer there, so when they moved the dental practice, he said, we can't have this. So he talked with dentists in the community and said, we need to outfit this dental clinic and provide dental services to the Williamsburg, James City, York County area. So he got together with the dentist. They worked up a schedule where they come in and volunteer on an ongoing basis, and the dental clinic opened in 1997. And it didn't open 5 days a week, but maybe they would work a morning here or a day there. But right now we're open 5 days a week from 8:30 to 5, and we have 24 dentists in the area and dental hygienists that provide volunteer assistance for our patients. We have an oral surgeon that volunteers there, and it's just turned out to be a wonderful program. And on Saturday, February the 27th, we hosted our first children's dental clinic, and we had 88 children from our area, some from York County, that came there to have their teeth looked at, and they even did extractions, restorations, fillings, fluoride treatments, sealants, and cleanings, and there's a lot of need for children in the area for their oral health care.
You are very fortunate to be able to provide those services, because I know that with most clinics or facilities that provide medical care, such as yours, the last thing on the list usually for someone is dental.
Yes.
A lot of people go lacking.
Well, even
taking care of their
when
teeth.
Dr. Norman was talking about the OB prenatal program, we actually start with those expectant mothers, and we will actually escort them over to the dental clinic, introduce them to the folks there, and so if they have needs, we'll take care of that. But then once their child is born, I don't know what age, about 3 months or 6 months, they come over and we do their first screening.
Okay.
And it's also nice with our chronic disease patients, like a diabetic, for example. If they have poor dentition and really bad teeth, it tends to make their chronic disease very difficult to manage. There's also been some studies suggesting that poor dentition can also make you higher at risk for heart disease. And so I think the clinic's really neat how the clinic has worked together, both the dental side and the medical side, to give comprehensive health to our patients.
Okay.
And we work closely with school nurses in the area regarding the dental program. And it's just really become one of the golden services that we provide there at Olde Towne Medical Center.
Okay. How does the dental clinic tie in with Smiles for Children? Tell me about Smiles for Children.
Smiles for Children is a national program that's actually managed by Doral, and here in Virginia, Smiles for Children is handled through FAMOUS, which is the children's insurance program, and if someone is FAMOUS eligible, then they're eligible for Smiles for Children, and we have a listing of those individuals, and we periodically will send out mailings to them to encourage them to come in for treatment, dental services.
Okay. Olde Towne Medical Center sponsors free screening clinics for the uninsured residents in the jurisdictions that you serve for ages 18 to 64. What type of screenings do you do at those clinics, and how often are they offered?
Sure. So we have two basic kind of screenings. We have adult screenings that happen twice a year, usually in, I think that's in May and September. Is that right?
May and September.
Yeah. And on those adult health screenings, we screen for blood pressure, cholesterol. Again, we take that as an opportunity to educate patients on healthy lifestyle. For our males, we might do prostate cancer screening. And then we also, twice a year in January and July, have health screenings primarily for women that are screening for cervical cancer, and we help arrange patients that meet the criteria to get mammograms also.
Okay.
And so those are free clinics that patients who don't have insurance can come to twice a year at Olde Towne to get those important health screenings.
Okay. You also operate a family health care van out in the community. How often is that van out in the community, and does it have certain locations that it goes to?
Yes. It's usually out in the community 3 or 4 days a week. Some of the primary locations that it goes to is the Grove Miller Mart. It goes to Burnt Ordinary Apartments, Lafayette Square Apartments, Scotland Street, and then there's some other locations that are specific, like one of the retirement centers.
Okay. Dr. Norman, I know a lot of times you may write a prescription to someone and they may not be able to afford to be able to get that prescription filled. You offer assistance to patients in being able to get their medications, the MAP program, I believe it's called. Tell me about the MAP program and how it works.
So the most pharmaceutical companies have assistance programs. They're sometimes very challenging to access for patients. It requires a lot of paperwork, and it's quite sophisticated to get the medications. So we have a full-time staff that we get a grant through the Williamsburg Community Health Foundation, and the Virginia Healthcare Foundation has a program that helps us apply for these medications for our patients. I think last year we had, I think it was about $1.5 million worth of medications that we were able to get for our patients, not only at our health center, but private docs in the community can refer their patients in, and we will sign them up also.
Great, great. That's a great service. I know that you're always looking for money, you know, to enhance your programs and services, and I know that you do some fundraising efforts with Olde Towne Medical Center. Can you tell me about some of your fundraising activities?
Sure. They've evolved over time to where one of the primary fundraising events that we have now is affiliated with Ford's Colony and the Ford's Colony Men's Golf Association. And as a matter of fact, in a couple of weeks, they're going to be sponsoring a golf tournament they call the Olde Towne Medical Center Challenge. Last year, they raised around $51,000, which is tremendous. We, at one time, had the Autumn Leaf Golf Tournament, and that's evolved into several other types of events. And last fall, with the Autumn Leaf event, we had a hoedown for Olde Towne and raised funds through that effort. We've also combined in the past with other organizations to do the Monopoly. We have various mailings that we send out throughout the year. And then other churches in the community are very good about helping us in fundraising types of activities, and we go out and speak to the churches, and different mission groups affiliated with the various denominations assist us also.
Okay. Can you do online donations to Old Town?
You sure can. Yeah, it's oldtownemedicalcenter.org, and there's a couple of avenues for making online donations through our website. And we're actually in the process of improving our website. You know, as you know, all technology evolves, and we're in the process of having a new look probably within the next 30 days or so. But people can donate online.
Dr. Norman, what is Project Care?
Sure. Project Care, I explained how we have primary care services at Olde Towne Medical Center, but it's often difficult to get specialty services and hospital-based services for our patients. Care had tended to been fairly fragmented in the community. The hospitals provide a lot of charity care. The different safety net clinics will provide care, and the doctors in the community tend to be very generous, but it wasn't very coordinated. And so Project Care was an effort to, first of all, get specialty care services for patients that were in the safety net. But in addition, the hospitals realized that they were all providing charity care, and if we could coordinate that better, we could better provide services to these uninsured patients. And so the three hospital systems, Riverside, Centera, and Bon Secours, got together with the safety net clinics and the local health department and have created Project Care to create a system of care for the uninsured.
That's great.
Yeah, it really is.
Great, it sure is. Where is Olde Towne Medical Center located?
We're located on Old Town Road. That's in between Long Hill and US 60, Richmond Road. We're actually, if you go down the road, we're behind the Prime Outlets. And a lot of people know where the Prime Outlets are. We're at 5249 Old Town Road. We're located in the Human Services Building of James City County, and half of the building is Old Towne Medical Center, and on the other side is our Division for Social Services, and so it's a real good match working alongside social services.
Okay, what are your days, what days are you open and what are your hours of operation?
We're open 5 days a week, Monday through Friday, from 8 to 4:30, with the exception of Tuesday, when we're open from 7 in the morning to 7 in the evening, and then Thursdays we're open 8 in the morning to 8 in the evening to be available to individuals that are working that couldn't get off work and all. And then, like I said, we're open early in the morning for folks prior to going to work.
Okay. Tell us how someone interested in obtaining services at Olde Towne Medical Center, how they can get more information.
Well, they can go to the website and check that out, or they can call us at 259-3258. That's our main number. We do have brochures and other information at strategic locations out in the community, at the employment office, in some of the churches, the libraries, and all of that. I guess the primary way is to either call or check out our website.
Okay. Is there anything else that you would like to tell us about Olde Towne Medical Center?
Well, I think that in the short time I've been there, and that's only been 3 years, we have really made a lot of improvements in terms of the way we provide primary health care in the community. And as I mentioned earlier, the dental program is just growing. And one of our goals is to get more children involved that are Medicaid eligible or have no insurance. So I continue to see a lot of growth. I know last year we had around 1,100 new patients that had never been there before. And so that means that folks are coming to us because either they've lost their health insurance or lost their jobs. And as Dr. Norman mentioned earlier, a lot of our patients are people that are working. So I see continued growth, and for now we have the capacity to handle that. Last year we had close to 15,000 visits, and it wouldn't surprise me if next year it's not closer to 16,000 or over.
Well, I certainly wish you continued success in serving the citizens in our area, and I appreciate you coming to talk to us today about Olde Towne Medical Center. Thank you very much.
Thank you.
That's our program for today. I'm Minnie Scipio. Thank you for watching County Courier.